Welcome to the Moffitt Cancer Center here in Tampa, Florida. We're here today in partnership with Pfizer, who would provide us with an educational grant to host a Florida Smoking Policy Symposium. This symposium is really getting at some of the latest topics and areas of research within smoking cessation.
CDC shows that 70% of smokers really do want to quit. Half of Florida smokers say they tried to quit during the past year, and nearly 60% say they plan to quit in the next 6 months.
Moffitt is really honored to participate in this activity, this important event. We have a singular mission here at Moffitt, and that's to contribute to the prevention and cure of cancer. And we know that if we could eliminate tobacco, that would take care of 30% of all cancer deaths just right there. But as Scott mentioned, the prevalence of tobacco is not going away. I mean, it looked like we were making some strides for a while, but it's still about 23% among men. And it's not just cancer that it's killing, but many other common chronic diseases. In fact, more people die from heart disease due to smoking than they do to cancer. In fact, as far as I know, cigarettes are the only product that you can purchase that, if used as intended, kills you.
Tobacco cessation and providing the means to help people quit smoking is just as important as tobacco prevention, preventing teens from starting smoking in the first place. They go hand in hand, and both are necessary for a comprehensive tobacco control program.
In summary, smoking, an addiction that begins, as you've heard, in childhood, causes 500,000 deaths, disproportionately apparent to us here in Florida. Second, it's never too late to quit smoking, but quitting early is better. So even if you're 50 and 60, quitting is still worthwhile.
There are various chemicals in tobacco smoke, over 4,800 of them. 69 are known carcinogens. They are known to cause cancer.
You've already heard Amendment 4 mentioned. I don't know how many times today. I was going to start taking a tally to hear how many times we talked about it. Just a background information in case you're not familiar with it. It was an amendment that was passed in 2006. 15% of the Florida settlement dollars are supposed to go to tobacco education and prevention. And it established the comprehensive tobacco education and youth prevention programs.
If you look at tobacco and tobacco's influence, you can see that several of us up here represent the prevailing constituencies, that is heart, lung, cancer. Tobacco is so involved in causing illnesses in these systems, many different kinds of cancers. I'm simply here to mention today, in terms of heart disease, myocardial infarction, stroke, peripheral arterial disease, all directly related to smoking, Anything that we can do to turn around this primary reversible cause of death and disability would be to all of our interests here.
Smoking is best treated with a combination of medication and counseling. And according to the CDC again, you need at least 4 counseling sessions of at least 30 minutes each, including telephone and individual counseling sessions, both prescription medications and over-the-counter nicotine replacement treatments, and counseling and medication coverage for at least 2 smoking cessation attempts per year.
23.9% of men, 18% of women smoke, and 30% of all deaths among persons 35 to 69 are attributed to smoking. So that's pretty staggering right there, 1 out of 3 pretty much, right? And then approximately 46% of smokers attempt to quit each year, and only 5% succeed. So that's what we're really focused on at CSX. We're trying to help our employees succeed. It's really challenging going through and being an educator and trying to educate employees and encourage them to stop smoking. So one of the best ways a urologist explained this weekend was actually to tell the smokers that 60% of male smokers have ED sometime throughout their lifetime, so erectile dysfunction may be the way to win the war, so who knows.
The American Legacy Foundation recently issued a report that shows if every Medicaid recipient quit smoking, the state will save $346 million over 5 years. That means if you would get 10% to quit, we would save $35 million and it badly needed revenue after 5 years.
First of all, I want to thank Men's Health Network and Moffitt and Pfizer and the Pinellas County Health Department for sponsoring this great event. One of the most powerful things that public health groups can do together is come together and have an open dialogue and exchange ideas. And these kinds of forums are incredibly helpful in that regard.